where should you do your medical residency? In Germany or in the UK or then in the USA? Is it easy to get a job in the USA, in the UK, or in Germany? Where is it most easy? Where do you get more money as a resident? In some countries like Germany, your salary during residency is more than in the USA, but on the long run, the USA is more. What are all of the differences? How easy is it to get a residency position? What are the advantages and disadvantages of doing a medical residency in the UK or in Germany? For this purpose, these questions are always asked in our community with more than 200,000 doctors in Germany. We are very delightful to host a Pakistani doctor who is working in the UK since 2015. You can see him, of course, on the screen. This colleague is a consultant in internal medicine and in stroke medicine. Yes, in the UK, internal medicine specialists can do stroke medicine too. In Germany, for example, where I am a neurologist, internal medicine specialists cannot do that. So our colleague is not only that, with a bright knowledge, he is also the admin of a group for the graduates of his university. I find it nice that he created a Facebook group for those students from his own university to help them know about the USA, the UK. We'll put the link to his post down in the description section. And most importantly, he's a PLAB examiner. PLAB are the exams for the UK, and he's an examiner there. Maybe if you are a medical student and decided to go to the UK, so you will meet Hussam. So drop a nice comment about him now. Maybe he will remember that. Hussam, we are very happy, delighted that you are here today with us. Thank you. I understood that your children are now awake, and this is why you are in your car. If someone asks why he's in his car, that is very nice of you. And thank you that you are taking time from your children, your work, and explaining to us the UK route. And we are going today to compare it with the German route. Do you want to say something at the beginning?
Absolutely. First of all, Jamil, I would really like to thank you from the bottom of my heart for inviting me for this talk. I must say that you are one of those people who I have not really met face to face in my real life, but I'm really very impressed of. Firstly, because you are a neurologist, and neurologists are the people of the brain. They study brain,
the
they manage
members
brain.
know me, but we would like to know about you.
Yeah.
So can you?
So really, thanks a lot for inviting me, and to all the audience today, a very warm welcome to our talk. So my name is Dr. Hussam Jamil. I am Pakistani by my original citizenship. I've been living in the UK for the last 10 years now. I came here in 2015 after passing the PLAB exam. Currently, I am a consultant in acute medicine, general medicine, and stroke medicine. So three specialties. These are three. So acute medicine is a specialty that more so exists in the UK and not much in the rest of the world. But regardless, so I'm a consultant in these specialties, and as Jamil pointed out, I'm an examiner of the PLAB exam as well. So thank you once again for inviting me on this platform. And how about you give me a certain aspect of the UK life for the doctors, and then I can talk about it as you wish.
Great. Thank you very much, Hussam. We'll be going that systematically. Before starting that, what do you think? Which is more attractive? If a doctor asks you, I don't know if you can answer the question. Medical student, we have three doctors. A medical student, a doctor who's in his internship year, and a doctor who graduated since 2 or 3 years. All of them asked Hussam, where should I do my medical specialization? Germany or in the UK? What would you answer?
There is a one-word answer, then I would say UK, and I'm really sorry, I'm a bit biased here. So I will say the UK.
To all of them.
To all of them. But having said that, I totally appreciate that Germany has a lot of advantages over the UK, and I totally appreciate that. I think that UK is going to be a very good fit.
Okay, we'll see that. For me, I do not have a lot of sure information about the UK, but for someone who finished his medical school before a few years, and he's now a specialist, certainly go to the UK, not to Germany, because your specialty would not be recognized in Germany, whatever you do. You need to do exams and such things. We will see. So Hussam is very convinced of the UK. I am convinced more or less of certain aspects of in Germany, and we'll see at the end of this discussion what will Hussam think about Germany versus UK. Hussam, thank you very much. So we can start now. And I thought that your photo will be minimized. Okay, so this is the article I talked about, and we'll be speaking now about Germany versus UK. The article in my website is Germany versus USA. And if you read the article, you will have like some things that are similar to the UK, but now, thanks to Sam, we'll have now a definite answer how the situation is in the UK. We'll start with the topic of actually the chronological order, or the order is not that good, but we can start with it so as to not forget anything. Changing specialties, Germany versus UK. In the UK, is it easy to change your medical specialty once you are accepted into a residency?
So, in the UK, first thing we need to understand before I answer your questions, something very basic that we need to understand in the UK is that the training pathway from the junior most level to the senior most level is not run through. So, for example, in the US, let's say you get residency into a specialty of urology, let's say. So, you start from year one, and maybe you go all the way up to year 5, year 6, however many years you are, and then you become a consultant. It's a direct pathway. In the UK, it's not necessary that the specialty you choose will have a direct pathway or not. So, the first 2 years are the foundation years, like the houseman or the house job, year one and year two.
Okay.
After that year two, you
Okay.
apply into a specialty in which further there will be 2 years as a middle grade or like a senior house officer level. Okay? And in those 2 years, at the end of those 2 years, you will then apply again for the third time in the higher specialty or the higher training years of that specialty. So I'll give you an example. If you want to become, let's say, a general surgeon in the UK, let's say, first you will do 2 years of foundation program, FY1 and FY2. After FY2, you will apply into core surgical training, CST. That is a further 2 years. And in those 2 years, you are expected to pass the MRCS exam. Okay? Let's say you do those 2 years of core surgical training and pass MRCS. Now, you will apply into general surgery training for the third time. You will apply into a residency program and starting from the registrar or the middle grade level. That will be further 5 years and then you become a consultant. So this route
Or
is
specialist.
of a specialist, yeah.
Okay.
Consultant is a specialist. So this is a kind of a broken route. It's not like you get into foundation year one and you will automatically go up to the level of the specialist without any interruption. No, the route gets interrupted few times where you have to apply again and apply again. So this is how the UK differs. Now, coming back to your question, is it easy to change specialties? Yes, people change specialties all the time. However, if you are changing a specialty, the new specialty you are applying to, at the interview, they would like to see that if you are leaving a certain specialty and coming to us, what have you done in your CV to show interest in our specialty?
In the new
So, for
specialty. Okay.
example, yeah, so for example, you are a GP in UK and you want to do cardiology. You want to change the specialty, okay? So after when you are appearing in the interview panelists would expect that you should have done some cardiology clinics, you should have gone to cardiology conferences, you should have done some sort of a not necessarily high level, some mid level or low level research in cardiology and things like that. So there should be something on your CV saying that you have shown some commitment, some interest towards the new specialty that you want to change. As long as you are showing that and as long as you perform well in the interview, you can change specialty in the UK. Yes.
Thank you very much, Hussam. So to understand that well. So you do the PLAB exams firstly, PLAB 1 and 2 or 2.
Yeah.
Okay, and then you do a medical this language exam, OET, occupational English test.
Do you want me to take you through the PLAB route as well? Shall I talk about the PLAB?
Yeah, you know what? Maybe that was better to or should we okay, Hosam, then please can you summarize in a few steps how to get into the UK program firstly, UK system.
Okay. Yeah, sure. I can explain that to you. So once again, entering into the UK has multiple routes. There's no one single route. There are multiple routes. So, but I will focus for the sake of discussion only on the PLAB route for now. For the PLAB route, first thing you have to pass, first of all, is the English test. Okay? So there are two main English tests, either IELTS or OET. Apparently, I mean, back in the day when I was applying for PLAB, there was no OET. I did IELTS with a very good score.
IELTS is very hard. IELTS is easy. Okay, so you are done with the language exam. Second thing.
Second is PLAB, and PLAB part 1 is purely MCQs, and they come from the final year clinical subjects of your medical school.
Okay.
It will not ask anatomy, physiology. It will ask questions around pediatrics, surgery, medicine, ENT,
like step 2 CK in the US.
Exactly, just like step 2, but far more easier than step 2 CK. It's a very easy exam, PLAB 1. And PLAB part 2 is a purely OSCE style practical exam which takes place only in Manchester, UK.
It is what for an exam? PLAB 2?
PLAB 2. PLAB 2 is a OSCE, like a
OSCE, like the USMLE step 2 CS.
Yeah, it's a OSCE like exam, and it only occurs in Manchester, and there are many academies in Manchester and London which you can attend to prepare for this exam.
And this exam is only done in the UK, or can you do it somewhere?
Only in the UK, in the city called Manchester.
Okay, so great. So you do the PLAB 1, PLAB 2, you succeed, you have the OET or IELTS, and then you will apply for this postgraduate training 1.
Yeah, so once you pass all the PLAB exam and English exam, first thing you will apply for, and you will get that easily, is called GMC registration. GMC is the General Medical Council of the UK, and unlike Germany, GMC is for the whole of the UK. I understand in Germany, every state has a separate body, but in the UK, but in the UK, there is only one body for the whole UK. It's called GMC. So after passing the PLAB exam, you get registered to GMC, and now you can start looking for jobs in the UK, or you can start to begin to think to apply for training in the UK. Yes.
To apply for what?
Training post, like residency post.
So, and you to apply for a job, what do you mean? I can work as a GP without specialization?
Yeah, so that's the thing. In the UK, unlike many other countries, including Germany, in the UK, there is an option of apply. If you don't want to directly apply into residency, there is also option of applying into non-training posts, and the non-training posts are called the trust. Trust means hospital, means trust grade posts, or non-training post means the senior house officer, the SHO level posts. So these are advertised on NHS jobs. NHS is the National Health Service of the UK. So NHS jobs, if you visit that website, and you can then start applying for these jobs after you pass the PLAB exam. So that's what if you want to do. If you want to directly apply into residency or the training program, then for that there is a separate website called Oriel, where you can go and make an account and start applying for the training posts.
How do you write this website, Oriel?
ORIEL. Oriel.
Oriel.nhs.uk.
I think so. I don't remember the exact ID of the website, but there's an Oriel website where you make an account and you can start applying. Yes.
Correct. I see that. Great. And after that, okay, if you want to go to, and how is the salary if you choose to work from NHS job?
So it depends upon your personal circumstances. If you're starting from a junior level and you are married and you have got two kids, for example, then my friend, you're going to struggle. Okay? Because if you are taking care of yourself, taking care of your better half, taking care of your children, in general, invest, particularly in the UK, the childcare is expensive, the rents of the homes are expensive, and with the passage of time, because of this Russia-Ukraine war, the fuel prices keep on going up, and there are a lot of issues. Yeah, but if you are on your own as a single person, then that is quite affordable. That's a quite decent salary. So in salary terms, at the junior level, your take-home salary per month in British pounds is around £3,000. 3,000 British pounds after taxes. Yeah. And then there's also an option of doing locum shifts. So many times, if at work your colleague is sick or there is a doctor missing and a shift is available, and they're going to put out the advertisement for that in your hospital WhatsApp group or somewhere, and then you can take that shift, and in that shift, you get paid by the hour. So let's say your salary is around £3,000 a month, and a locum shift of 8 hours can yield you another 450 pounds
Net
just for
salary.
one shift. Yeah. So what a lot of people what they do is that they do locum shifts every other weekend, every alternate weekend, and considering that they are able to save a decent amount of money. Yeah.
Great. I was in London before 1 month. I met a bus driver. He was Greek. So I asked, why are you here? He said, more salary. I asked him and he said he has a net salary of 3,000. So a doctor in this position has so much salary as a bus driver.
My friend, the locum rate I told you for a doctor is £60 an hour, or differs from hospital to hospital, but £50 to £60 an hour. And same is the rate if you call a plumber. If your pipe has burst at home and you
Wow.
want a plumber to come and fix it, he will charge the same amount of money, £60 an hour.
Okay, interesting. But of course, as a
So
doctor, you work like 8 hours. A plumber will work 1 or 2 hours, and then yeah.
exactly. So overall would be great, and that's a very good point. And also, this salary I'm telling you is only at a junior level. Once you become a specialist or a consultant, then the salary goes up substantially. Gets much
Great.
better. Yeah.
Okay, so this is why I'm asking about the salary because some people do not. Is it easy to get a residency position then?
So it depends upon the specialty, my friend. This is the greatest advantage of Germany over the UK. This is where Germany totally beats UK. In the UK, the only specialties which are easy to get, and to be fair, they are getting more and more difficult even in the last few years, but still, which are relatively easy to get, are psychiatry, internal medicine, okay, accident and emergency, GP, and pediatrics.
Wow.
Okay, forget about radiology, forget about anesthesia, forget about surgery. No way, you're not getting that. I mean, people get that. I don't want to discourage the audience. Please, if you are very passionate about it and you have worked very hard on your CV, go for it. Do apply. But in my experience, I know literally a very few IMGs who manage to get into these specialties. But I think
Oh,
compared to UK, in Germany, you have a better chance of getting these difficult specialties. Am I right?
yes, yes. Thank you very much. So we are finished with PLAB 1, 2, the English language exam, and I want to apply on a residency position. So I will not be able to apply for a residency position. I will be doing PG 1 and 2, right?
Okay. So the first thing I want to correct is that the first exam you will pass is the English exam, not the PLAB 1 exam. So the English exam you pass first, then PLAB 1, then PLAB 2.
Why
Second is
can I not do the PLAB exam and then the English exam?
no. You're not allowed to sit in the PLAB 1 exam without OET or IELTS.
Okay, good.
Yeah, that's a prerequisite.
Okay.
So that's the first thing. And the second thing is it depends on which level you are coming. So here is a wonderful thing about the UK, which is very different from the rest of the world. UK welcomes doctors at all positions into its system. So, for example, you are someone in Egypt or in Jordan who has done a residency in ophthalmology, for example. Yeah. And now you want to come to the UK. The UK will accept your residency in a way that it will give you a post which is not very junior and which is also not very senior, somewhere in the middle. And it will be a non-training post, and you will earn a decent amount of money. Okay?
How much?
So that is called that post is called a registrar post. You will be a registrar in ophthalmology. And then UK gives you an option. There is a training route, to get into a training post and become a specialist or a consultant. That route is obviously there. But then there is, very interestingly, a non-training route to become a specialist. It's called CESR, Caesar pathway. In the non-training route, let's say you have done ophthalmology residency in Egypt and you are a registrar in, let's say, Birmingham in England. Now you want to become a consultant using the non-training residency route. So in that non-training residency route or the Caesar route, the hospital where you are working, they will start working on your CV and they will provide you opportunities and they will give you suggestions and options and help you to become at the consultant level. But it will still take a further 3 or 4 years. It's not straightforward. It will still take 3 or 4 years, but then through that non-training pathway, you can also become a consultant in the UK. But the way it differs is that if you became a consultant through that non-training pathway in the UK, and let's say you want to now apply for jobs in Middle East, let's say Saudi or Dubai, then in Dubai or Saudi, they would rather prefer someone from Germany or America who has done a proper board training residency over you. Does that make sense?
Yeah. And so, how can I? So, I need to be a consultant first to apply in the Gulf countries.
Yeah.
Okay, so okay, good. Understood. Okay, great. And to get you into a residency position, you apply for postgraduate year 1 and 2.
So that depends that on what level you are coming. So like I mentioned, the people who
Medical
do
student,
okay, medical student, perfect. Yeah. So if you are a medical
new
student
graduate. I
and you
mean,
have passed your PLAB, and let's say you have 1 year house job experience from your home country, then the best position to apply for is either an SHO in a non-training post, okay, or a foundation year 2 training post, FY2, because you have done level 1 at your home country. So getting into level 1 in the UK is going to be very difficult. So just apply into level 2. Once you get into level 2, or once you get into a hospital SHO position, then you can start working onto your CV and start applying into psychiatry or GP or accident emergency wherever you wish to. But the first post is going to be either an FY2 or the foundation year 2 post or an SHO post in a UK hospital for
okay,
medical
someone who
students.
finished medical school, do I need to end my internship year?
So, yes, I tell you why. Because the way it works is that first you pass the English exam. Okay. After you pass the English exam, you can sit in part one of PLAB. And after passing part one of PLAB, you can sit in part two of PLAB. What did I say earlier? I said that after passing all these steps, you apply for GMC registration. Now, GMC will not give you registration unless you have a 1 year housemanship or 1 year internship from your home country.
Good. So I've finished internship year, the two PLAB exams and the English language exam. I apply them for a postgraduate training
So
year 1.
for GMC registration first and then postgraduate training. Yeah.
Year 1, and this is, and for this postgraduate training, are there many types of it, or simply one type?
There are many types of it. So one type is called the proper foundation year 2 or the FY2, and the other type is called the SHO grade, yeah, or the non-training FY2. So if you go to the websites, the terminology unfortunately is very, very confusing, and that is one of the reason a lot of medical students get put off by the UK system. Germany, US, they have a very straightforward
Yes.
terminology. But UK, the terminology is very confusing. So if you want me to simplify it, there are two posts, and those terminologies are attached to or linked to one of these two posts. One is Foundation Year 2, and the other is SHO. They're both the same, but Foundation Year 2 is the proper recognized residency, and the SHO is the non-training recognized hospital experience work,
Okay,
or
good.
what you call in our home countries as medical officer.
Good. I got an approximate idea. So,
It's
it,
confusing. I can understand it's confusing, and if anybody has questions, I'm happy to answer those questions.
thank you
But
very much. But
but
comparing,
the thing
yeah,
is,
please.
that let's say if you want to become a surgeon in the UK, whether you come into the proper FY2 pathway or post, or whether you come into the SHO, the non-training post, the opportunity to get into the surgical training for both is the same.
Okay, thank you very much. So, I approximately understood that. So, the USA is the best. You simply do your steps and then apply for a residency, and that was it.
Yeah.
Germany, you do your medical Fachschreibprüfung, medical language test. If you did if you got the Gleichwertigkeit, equalness of your studies, then you will get the approbation and then you can start a residency directly. If you did not get the equivalence, you will then, there is a graph for that. I will show that to the audience. If you did not get this Gleichwertigkeit equivalence of your studies, then you will do the Kenntnisprüfung medical knowledge exam. And after passing it, you can choose any specialty you like. This is all the Gleichwertigkeit or equalness is required from non-European Union or EFTA countries, European Free Trade Association countries. And at the end you get the approbation. That was it. To explain the German route, it is like in less than 30 seconds. And what I saw
Yeah.
from you, Hussam, now it's a bit complicated. And you
It's
need to
complex. Yeah.
apply for the first position, then apply for the second position, third position,
Yeah.
improve your CB.
Yeah.
So it's a bit hard. And changing position in Germany, if you got like to get into minors hard. I know personally people still now who get ENT, who get radiology first or second job like within 6 months after starting work in Germany. Urology too. Even if they did not get that after 6 months, there I know people who were like for work for 2 years, 2.5 years, do courses, improve CV, and after 2.5 years they start working in a small praxis or clinic. The English word is clinic, and they get like small amount of money to have this year or two of residency in dermatology, and then they will get more money, or at least when they are specialists. So taking that into consideration, the German route is much easier in changing specialties and much easier in getting the specialty you like. So again, Hussam, like anesthesiology did not mention that. Is it really hard to get anesthesiology in the UK?
Anesthesiology, my friend, is. See, there is one thing we need to keep in mind whenever we are going to any foreign country for post graduation. You have to see what the graduates of that country, the medical graduates of that country, what
Like,
is their mood, what is
oh,
their liking, what is it that they want to do. And if a majority of them want to do a certain thing,
understood.
then
So, what
for
do they
you to
like in
get
the
into
UK?
that slot is very going to be very difficult. So in the UK, in the medical graduates and the medical students of the United Kingdom, anesthesia is probably very easily in the top three most favorite specialties.
Why?
Everybody wants to become an anesthetic.
Eh,
I honestly don't know. To this day, I mean, I've worked in anesthesia for a small amount of time when I was very junior, and I absolutely hated it. I did not like it. But I guess it has to do with the thrill of putting someone to sleep before surgery and with the thrill of putting someone back to consciousness after surgery. Maybe something to do with that. Maybe some people like to manage airways quite confidently. and that's what they want to do. But for some reason, not clear to me, everybody in the UK, pretty much everybody, wants to do anesthesia.
Is it more paid than other specialties?
No. So that's another thing. So the UK, unlike the US, follows a bit of a socialist-y system. The socialist means, so the people need to know two very basic economic concepts before they come to the West: capitalism and socialism. Capitalism means the harder you work, the more money you make. Socialism means you don't need to work very hard, you will eventually get almost the same paid compared to someone who's working very hard. Both have their pros and cons. UK follows a somewhat socialist approach. A qualified GP, a qualified surgeon, a qualified stroke physician, and a qualified anesthetics at specialist level have pretty much the similar salaries. Pretty much the same.
In Germany,
Maybe there's some difference, but overall, it's pretty much the same. And all of them get taxed in the same bracket as well. Same tax bracket.
Okay, in Germany, there are like tariffs. It is much or less the same salary at residence level, all the same, but starting from specialist level or consultant level, you can how do you say it? You can not bargain. You can how do you say it? I want no more 10,000. Negotiate your salary, right? So like specialties like cardiology, like dermatology, like neurosurgery, you can get more money in remote area in small hospitals. But in the big cities, university hospitals, the salaries are the same. Even if you are the best neurosurgeon in Germany, in the Charité, or the best in the same hospital, simply a GP or an internal medicine specialist who's a consultant, you will get the same salary. Very interesting, Husam. Thank you very much. This is eye-opening. Good. So we talked about changing specialties, which specialties are easy and hard to get. We covered this point. In the UK, Hussam, if someone says, I want to be a dermatologist, and he said, I want to improve myself firstly, do you think is it realistic to have such a dream, or simply forget it? Dermatologist, radiologist.
So I am the kind of a person who doesn't discourage people, okay? I have seen people becoming cardiothoracic surgeons in the UK. I have seen people become dermatologists in the UK and so on.
But
in general, getting into dermatology, getting into neurosurgery, mate, listen, UK is far smaller than Germany. Take a guess. How many training slots are there in the UK? And UK, by the way, is 4 countries: England, Scotland, Wales, Northern Ireland. Okay?
Okay.
Take a guess. In the whole of UK, each year, how many training slots are there in neurosurgery?
I'm not sure.
Just make a guess.
In which specialty again, please?
Neurosurgery. In neurosurgery.
How many hospitals are there in the UK?
About 1,200.
1,200. Okay. 1,200. If we said like 1/5 of the hospitals have neurosurgery departments, we are talking about 250 hospitals. 250 hospitals in each position. In each hospital, they would take 2 residents per year. So we will say 500. 500.
My friend, the UK every year has only 20 seats for neurosurgery.
20 seats. And who does all the work in all the work in the neurosurgery departments?
So this is the thing. The centers where neurosurgery is performed are far less. They're actually far less than 1/5, as you said. There's one regional center of neurosurgery for the entire big chunk of land. So that's one thing. And the second thing is that other specialties like GP has like 3,000 seats every year. GP is much bigger. Psychiatry has around 1,000 seats. Yeah. There are other specialties who have got far bigger number of seats. But neurosurgery, cardiothoracic surgery, vascular surgery, orthopedic surgery, these specialties have got very, very less number of seats. And just getting from an idea from the number of seats, you can answer your own question yourself. That what are your chances of getting into neurosurgery in the UK?
But who does the
Pretty much
job?
minimal.
Like in the neurosurgery department, there are like residents first.
So this is for 1 year. So the total number of years in neurosurgery are, I think, around 7 or 8 year training program. One batch of 1 year has about 20 people. So 8 batches will have 160 in total for all UK hospitals.
This is
So you're
okay.
talking about year 1 to year 8. Each year will have 20 people. So from year 1 to year 8, you have 160 people in total at the moment who are working.
How
20
many
times 8.
departments of neurosurgery are there? Do you know?
Neurosurgery in the UK, I think there won't be more than 25, 20 or 25, very few.
Okay, interesting. Okay, this
So
explains it.
that's the thing. All those hospitals who have neurosurgical department, they have a helipad where a helicopter can land. So the helicopter takes the neurosurgical trauma and flies all the way to the center where the neurosurgery is available.
Okay, thank you very much. I think the point is covered. Next point is exams for medical license. So compared to the USMLE exam, Hussam, how hard are the PLABs?
I would argue, although I only gave PLAB exam in my career, but I have spoken to a lot of people, I have a lot of friends. I would argue in the world of licensing exams in the Western countries, PLAB exam is the easiest.
Easiest, okay.
It's the easiest. It has got around, it changes every year, but the range is between 70 to 85% pass rate. Range.
And
It's different every year, but people pass it, and there are people who fail it as well. But you can always keep on trying hard. There are academies you can join, there are online courses you can attend, and you can perform well. So passing the PLAB exam is not a big deal. You can do it with dedication. I know people who failed every year in their medical school. In the final exam they would fail and they have to reattempt and then they would pass. Okay, and they became doctors and they passed PLAB in first attempt.
interesting. Thank you very much.
Compared to USMLE, PLAB is a joke. It's a very easy exam. And also, the money wise, in terms of the payment, in terms of the exam fees, it is also very cheap. USMLE is fairly expensive. I don't know the exact amount of money you spend on the German exams, but PLAB exam is easily around £2,000. And £2,000 is a joke. It's nothing, it's not much.
That is a very good question. USMLEs were before like 10 years, 5,000 US dollar. I don't know how much they are now. The German exam, the medical language exams between 300 and 500 euros, and the medical knowledge exams between 500 to 1,200 euros. But the thing with the German route, there are a lot of waiting time to get
Yeah,
the appointments. So this might be the negative thing.
yeah,
But 2,500 is not that difference, and this is only a one-time pay, so that it would not be a
exactly.
okay.
Absolutely. As soon as you get into job, you get all that money. You recover that easily. I think
Thank,
German pathway and PLAB pathway in terms of amount of money you spend on the exams is somewhat similar. I think.
thank you very much.
Yeah.
The next point is exam to enter into residency program. So you talked a bit about the topic. Hussam, if you are like you want to be a cardiologist, can you a medical student who a fresh graduate who finished internship year, PLAB 1, PLAB 2, and the English language exam. What are the steps he would need to take in order to be a cardiologist in the UK? Like in
Okay.
a small
So I
summary.
will I will be very to the point and very slow because I know medical students they can't take a lot of information at the same time. So I will go super slow, but I won't talk extra. You are a medical student and you have passed your MBBS and now you are a fresh doctor. And let's say you have also done 1 year housemanship in your home country. Now you
Internship
want
year.
to come to the UK.
Okay.
You want to come to the UK and become a cardiologist. First, you will pass IELTS or OET. Then you will pass PLAB 1 and then you will pass PLAB 2 and then you will apply for GMC registration, which you will get without any problems. GMC registration, they're easy people. Okay?
Okay.
Now you have got the GMC registration. Now you are going to apply for a foundation year 2 post, FY2 post.
Okay.
Okay? you got, and let's say each time you apply, you are getting successful. Let's make that consideration.
Okay.
You apply for foundation year 2 and you get it. Foundation year 2 is a 1-year program. At the end of foundation year 2, you will now apply for internal medicine training program, IMT. It's a 3-year program in which you will rotate in different specialties of internal medicine for 6 months throughout these 3 years. So let's say 6 months in respiratory, 6 months in neuro.
Understood. So 3
Okay,
years.
for 3 years. And there's a very important and. In these 3 years, you have to pass all the parts of a very important exam called MRCP.
Okay.
In IMT 3 years, you have to pass all parts of MRCP and complete your rotations successfully. So when you become IMT year 3 resident, you will now apply for the ST4. ST means specialty trainee. ST4 post in cardiology. Let's say you get ST4
And now
post
you
in
are an
cardiology.
internal medicine specialist, right?
At this stage, you are an internal medicine specialist, yes. But
Great.
now you want to become a cardiology specialist, so you will apply for ST4 in cardiology, and from ST4 to year ST7, there are 4 years 4, 5, 6, 7. From ST4 to ST7, you will spend 4 years in cardiology, and in these 4 years, you will get adequate, focused training on cardiology, and at the end of ST7 year, you will get what we call in England CCT, Certificate of Completion of Training. And this CCT, my friend, finally means that after all these years, now you are a cardiologist. Congratulations.
So you need 8 years in total.
Almost 8 years, yes.
Thank you very much. And there is an exam at the end?
I think there is only one theory exam during the ST4 to ST7 years. It's only a theory exam. And there's no exam at the end. No. There's no viva, no exam, nothing.
Okay. Thank you very much, Hussam. Great. Understood. And in the German route, there is no exam. Once you get a residency position, there is only
Yeah, man.
a German
You
board
guys are
exam at the end of it. It's an oral exam. In most specialties, in most cases, it is an easy one. And it takes between 10 to 15 minutes to 1 hour. And it depends more on your medical language, on how confident you are, and how safe as a doctor you are. You can find real board exams questions in a website. Um, it is called MIDI online. Oder Protokolle, Facharztprüfung. Then this one you will find these protocols, or you have texts of the exams, and you will see how hard the exam for specialty in Germany is. Great. Next questions. Age. Is it a problem when someone is 35 years of age and wants to come to the UK as without a specialty, Hussam?
So it depends now. At the age of 35, do they have any experience from back home?
Yeah, like GP.
Yeah, you can come and you can apply for posts in GP. You can apply for training in GP. You can apply for post in the hospital in medicine if you want to apply. Yes, you
Okay, so
can
it is the
welcome
same.
you.
Germany, UK is the same. Both of them allow such a doctor to come. For the USA, it is a bad thing to be an old
Yeah, so I will
EMG.
tell you, I'll give you an update. So I keep an eye on these things. For the USA now, there is an update. Because USA only takes at a very young age, yeah, and USA compared to the whole of Europe is a very, very, very big country. So what this mentality the Americans had, they were really struggling to recruit doctors from overseas and to fill their demand of doctors. So slowly now they are also adopting a pathway of UK and Germans. So what they are doing is that if you have done a residency in your country, then only in a few states, not all states, few
Thank you
states,
very much.
and only in the few places in those few states, you can apply without USMLE. They are starting this now.
With USMLE.
Without, my friend.
Without.
Yeah.
Are you sure?
I can share the links with you, my friend. They've just started it last year, but only in a few uh, small towns of a few 3 or 4 states. That's it. Not like
Okay.
Chicago or Florida. No,
Yeah,
like
of course.
small towns, small
Okay,
towns
it
only.
would be nice if you shared that link with me. Thank you very much.
Yeah, I will share
Later
with
on.
you.
Thank you very much.
Yeah.
How clear is the way for specialization? Germany is the best. USA and Germany are clear ways. UK, it's a bit complicated. Before getting your first salary, I think Germany and the UK. Germany, if you do not get the equivalence of your studies, it's a bit hard to get a job without the approbation, the full license. This can increase the cost of before starting your medical residency. For the UK, Hussam, if you finished your PLABs, the medical language exam, GMC registration, is it hard to get a position?
So nowadays, I would say it is getting a bit harder. 4 or 5 years ago or pre-COVID, it was easier. But now, because more and more people have realized that UK is a genuinely a bit of a cheaper pathway in terms of spending money, it is less costly. So more and more people want to come to the UK, and that has led to saturation. So when I applied 10 years ago, I got 3 job offers after passing PLAB within a month. But nowadays, people have actually, their waiting times have gone up to 6 months or 1 year after passing PLAB, actually. Not for everyone. Many people still get it fairly soon. But for a lot of other people whose CV is not very strong, they end up waiting for a year to get a job.
And how can you improve your CV?
Improve your CV by attending conferences, international standard conferences, by doing ALS course. I don't know what they call in Germany when someone goes into cardiac
Advanced life
arrest and you
support.
do, yeah, advanced life support, exactly. And then you can do some research, and it doesn't have to be like a randomized control trial level research, just like case reports or small retrospective studies. Even if you do that, that's good enough. And then you can improve your CV by doing. There's a thing in UK which is very popular. I don't know about German or US. It's called clinical audit. So in clinical audit, the medical practice is seen how close it is to the to the guidelines, and then it is done. It is. I mean, it's a different topic altogether. I don't want to go into details. But if you happen to be in a country or in a place where they do clinical audits, the UK people, they love it. So do that, and then you can also do teaching. The UK absolutely appreciates and loves those who do clinical teaching to medical students or to doctors or to even nurses. This is totally appreciated. So yeah, these are some things which can improve your CV.
Thank you very much for that. And what about doing an observership?
Yeah, you can get an observership, but bear in mind that observership will not. It will make you more aware of the system in the UK. You can come to know more about it, but it will not guarantee a job. Job depends on how well you perform in the interview.
But if you
But
like, you
yeah, you
have
can.
an experience in the UK, you dealt with patients, you dealt with UK doctors, of course, you will do better in an interview.
It's better, but it's not something. I mean, there are people who got jobs without observership, and there are people who did multiple observerships, but they had to wait long to get a job. So it's good on your CV. I'm not saying you shouldn't do it if you get to do it. If please go for it, do it. But it's not a guarantee, or it's not something like a prerequisite to get a job. In the US, electives or experience matter a lot at observership level, but in the UK, nah. You'll notice this. Every nation, every country has its nature, has its behavior. Okay, so the Germans, they are always seen as people who are very engineering minded and very focused and very
Thank you
professional.
very much.
Americans, they are seen as people who are very hardworking, and they want to be the best of the world. They want to be at the top of everything. Yeah, we are Americans. British, relax, chill. There's no rush in life. Enjoy life. Cool. Yeah.
But
If you have done a
Hussam,
clinical attachment, if you have
yeah,
done an observership, good for you. If you have not done it, good for you. No extra marks.
But the thing is, Hussam, in Germany, doing an observership, it is very, 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 very important. Why? When you are a resident, you need to do such things that a resident doctor needs to do, like admission of patients, entering the medications into a computer or writing them, taking samples to the lab. It's like making telephone calls with family physicians, talking with the relatives, doing reading about the patient and the system. And if you did an observership, you will know all of these things. So I am now a consultant. So to have someone who already knows what does a resident do? It's you are not asking him to be at the doctor house and to diagnose hard cases. You simply want him to do the things that a resident doctors do. To admit a patient, to write correctly his medications, to take proper history, to enter his medications to the system, to talk with his relatives and complete the medical history, to talk with the family physician, to do Aufklärung. This is something that is important in Germany, to explain a procedure to a patient, and then he will need to sign a paper about that. So I do not understand why isn't that important? Why would a UK hospital tell someone who has never worked in a UK hospital, you will work, because he simply visited conferences, and not accept someone who's experienced in the system?
I totally understand what you have said, and I totally agree with it. But then the way UK covers it is that once you start working in the UK in a proper job, in the first few weeks, they will not give you a lot of patient load. They will not put you on night shifts. They will not give you the on-call bleep pager. You will just do a simple job for the first few weeks, in which you will get all the support on how to prescribe,
In Germany
how
too,
to
in
write.
Germany too. But like if you have two candidates, someone who's experienced in the system and someone who's not.
So yeah, no, that unfortunately in the UK, it doesn't matter. It doesn't matter.
Okay. The next question, it is related to this topic, Sam. If someone asks you, I am now a fifth-year medical student, I want to come to the UK. How can I improve my CV? What can you tell him? A few points.
My friend, first thing you need to do is to show interest in patient-related care by attending some conferences, international conferences.
Okay.
Number one.
Number two.
Second thing you can do is to do a low grade research, like a case report or some small retrospective studies.
This is not important in Germany. Number three. Or important in Germany if you want to apply later on to a university hospital. Number three.
Number three thing you need to do in the UK is a course like an ALS course.
ALS course, you take it in 3 days. And after that, what would you do?
So you get a certificate, and then that you can show that certificate on your CV.
Yeah, but it's done in 2 or 3 days, the ALS course. Something else?
And then what you can do is there are some specific courses that you can do online, which will really be appreciated. So, for example, communication skills course.
Thank you.
If you have done that course, that will come across as very good.
English
exactly.
Language.
Exactly. Yeah. But
Good.
Communication skills in a medical setting, not just general English, like in a specific clinical environment. And then another thing you can do is develop experience in teaching and training. So, for example, if you are in house job and final year or fourth year medical students are coming in your ward where you are working, give them a 15 or 20-minute bedside teaching on, let's say, acute abdomen, or how to examine the respiratory system. Something simple as that. Okay? And after you have given that teaching, get some feedback form from them, get the feedback form filled from them, and show that feedback as evidence that you have provided teaching. It means a lot in the UK.
Feedback, how do you get it? Feedback, how to prove it?
So I can share the link of that feedback form. It's from the Royal College of Physicians of UK, of London. You can download that form and get that form handwritten by the people who attended the teaching.
Okay, good. So give it to all of your friends and they should sign it. Good.
Yeah.
Okay, Hussam. Okay, so German is a bit different. The most important thing is communication skills and the language. You can start learning the language. But withdrawal of blood, do doctors do that? Inserting cannulas.
Yes,
And withdrawing bloods from the wards, do the doctors do that or the nurses?
the doctors do the bloods and the doctors do the cannulas. In some hospitals in England, nurses will do the bloods, but cannula is still expected from the doctor.
Wow. Okay, interesting. In Germany, like in at least 90% of specialties of hospitals, the doctors are responsible for that. In the emergency departments, maybe
Oh,
one
yes.
third. It is 50-50. In some hospitals, the nurses do that. In others, the doctors do that. But contacts are very important in Germany. If you know a doctor, you can get a job there. How is it in the UK? If you know a doctor, can you secure a position?
So, yes, I think making contacts with the consultants is important, and making contacts will help you. But the UK tries to be a very fair and a very just system. So, for example, if you know a consultant, let's say in gynecology, and you want to work in gynecology in the UK, so it won't be like this that the consultant will call you in the office, take your interview, and give you the job, and you will start working from next week. No,
In
it doesn't
Germany, it's
work
like
like that.
this. Okay.
Okay. In UK, what will happen is that the post for the gynecology ward for doctor will be posted on a website, and it will stay on the website for at least 2 weeks, so that
Hussam, I cannot hear you.
we know, sir, that you guys advertise this post to the whole public. It's a part
Okay.
of a fair process of recruitment. So that post will be processed, and then you can apply, and then maybe other people will apply. And you really have to give your best in the interview. And in that interview panel, not only the consultant you know will be sitting, there will be other few consultants and other few people from the hospital sitting in that panel as well. So it will be a very like a focused interview, and they all have to be happy from your performance in order for you to get the job, not just one consultant that you know.
In Germany, if one consultant is happy and he has good connections in the hospital, he can do that. And in most hospitals, there is a shortage of doctors in specialties like anesthesiology. By the way,
My
anesthesiology, it is one
God,
of the easy
my
jobs
God.
to get in Germany. By the way, there is like job doctors here in Fakhas. Yes, you can contact Thomas, who is a German specialist in training. The link is above, and he can help you in finding a job in anesthesiology. This is one of the easiest jobs in Germany. And the other jobs are psychiatry, internal medicine, general medicine is also easy. Voluntary work, is it important, Hussam?
Not really, no.
Okay, research, good. That was it. Okay, next point, Hussam. That was very interesting. Thank you very much. I believe that a lot of people will profit from that. Um, research opportunity. To do research in the UK, should you go to a certain hospital or all hospitals do that?
I think if you go to a certain hospital, like a tertiary care hospital in a big city, those are the hospitals which prefer giving more training on research. But then there are some smaller hospitals as well who have a research department. UK in doctors in general are quite chilled out. They don't bother about research too much.
Are there like university hospitals in the UK?
Oh yeah, yeah, yeah. There are.
Okay,
Yes.
good. In Germany, university hospitals do the most of the research, but if you are in a
Same,
small
same,
hospital, you can
same
call
here.
a professor in a university hospital, tell him you want to do a research, and he can help you because doctors want to do research to get that in their CVs. Good. Um, shortage of doctors in the UK. It seems it's not. Is there a shortage of doctors in the UK?
So over here, I would like to give the current day problem that the UK doctors are very frustrated about. And I think when I
Okay.
spoke to you last time, Jamil, I mentioned this at that time as well. I will say again.
Yeah, yeah,
There
that was a
is,
great point. Please.
yeah, there is a new role called physician associate, PA, which has started in the UK, and similar role has started in the US as well. So basically, this role, you are not a doctor. Your job is to assist or help the doctor. But the politicians, unfortunately, they are corrupt politicians all over the world. The politicians in the UK, what they want is that because it's only a 2 year course to become a PA, physician associate, they want to generate these PAs more and more, and they want them more and more in the UK hospitals so that they can do more and more work, and the reliance on the proper doctors is less. So now they are bringing more and more physician associates, and unfortunately, there have been so many incidents by these physician associates of patient safety. So many patients got, hurt and badly managed. Some died even because of the mismanagement of the physician associates. That now they're thinking, no, maybe this is a bad idea and we should stop it. But so far, the job market has also dropped a little bit because they're trying to replace doctors with physician associates. Something similar going on in Germany?
Yeah, there are a few, but the Germans are very slow. They talk a lot about that since years, but I did not
Okay.
find a lot of physician assistants.
And these physician associates, some of them are actually very good and they do their job well. They do help the doctors, but the other ones are so arrogant sometimes, and
Really?
they think they are above doctors and they will treat you as if they know more than you. And it's so
After two
funny
years of
at
training.
times. Yeah, just 2 years of training, mate. And it is so frustrating at times that what do you think you are, man? What are you trying to prove? But this is a problem recently, and because of the politics, you can't really shout at them. You can't say bad things on them, and you have to stay quiet, even if they say something stupid.
Um,
It's a mess. It's happening all over the world. There's an uproar everywhere, and on social media, there's a lot of fight going on between doctors and PAs. Oh my goodness, it's a mess. It's a complete mess. But yeah, so coming back to your original question, that is there a shortage of doctors in the UK? I would say yes, there is, but unfortunately, these bad politicians, they're doing a bad thing of trying to replace doctors with physician associates, and my prediction is that this will end up very badly, and they will come back to recruiting proper doctors instead of physician associates.
but to understand the point of view of these politicians, because in Germany there's the same problem. They want to save money, so these
Exactly.
they get less salary. A doctor is like 1 year and he's now away, and 2 years he's a specialist. He want to go to Dubai. He's maybe speaking not very well English, and some jobs are tasks are very easy, like withdrawing blood, putting cannulas, talking with the parents of the patients, talking to the family physician, and it is easier to delegate these jobs and not to be always getting new doctors teaching them the system, and then they are leaving in 1 or 2 years. So, and there's a shortage of doctors. So for hospitals in Germany, many hospitals are private now, and they want to save money. So it is easier to get someone who did 2 year of study, and he will accept a much less amount of money for a salary than a doctor who wants always a Porsche or wants more and more money. And the young generation, me too, I passed this period, but I think the new doctors in the world are not going to get a huge salaries, and the paying is being less and less with the time. Good. How hard is the work in the residency period? What is a normal working week for a resident in the UK? Is it like 8 hours per day, 40 hours a week?
It is 8 hours per day, but you know what really is. I mean, I don't mind, but for many doctors, what's the worst thing about training in the UK?
What?
The worst thing is, unlike Germany, unlike US, the worst thing of the UK training is that every year you change hospital.
Mm.
And that new hospital, which you will change every year, might be very far from your home. So you will get tired, even if it is only 8 hours a day, you will get tired just driving from your home to work
But
and
why,
from
why
work to
change
home.
hospital? If you did residency in internal medicine, you said 3 years. Why change hospital?
No, they changed. So if you're doing 3 years in IMT, 1 year would be in a university hospital, and other 2 years would be in different district general hospitals.
Okay,
It's a
internal
rule.
medicine. And surgery the
Yeah.
same?
Same.
Okay, good.
Neurology same. Cardiology same.
Good. Thank you very much. And working the average working hours of doctors, how many are they?
40 hours a week, 9 to 5.
Okay, and do you have a lot of work sometimes so that you need to remain 2 or 3 extra hours?
Yeah, but then you can, apply for getting paid for those extra hours.
And would they discuss with you and tell you, Hussam, you were speaking on the phone to your wife, you are not quick enough? Would they say something like this?
If you are being lazy, everybody will notice that, and everybody will give you negative feedback that we are not happy with you. So yeah, you have to be.
Sometimes you are not lazy, simply you are working. Like some doctors, they can like take care of 10 patients and they will give you 16 or 17 patients, and your colleague is
Mm.
now sick and you need to take care of 25, and at the end of the day they will tell you, why did you remain 3 extra hours? This is sometimes the situation in some German hospitals. In the UK,
This in the UK, this can happen. This cannot happen. Depends on the hospital.
but they will
I
not
wouldn't
discuss
say
a
that
lot,
there.
why did you stay late?
No, they will not. In general, no.
In Germany, it's unfortunately getting a problem with the time. Thank you very much. Racism. You do not need to answer the question if you are
No,
shy.
no, no. I can happily answer this question. So the thing is that racism is present. I would argue, in my opinion, and I'm happy if anyone wants to disagree with me, but I believe that racism is present in every single country on this planet.
Correct. I
There is
will say this.
no country where there is no racism. Okay, so if you come to the UK, please don't expect that you will not face racism. You will. But the good thing is that if you face the racism, there are systems in place where you can raise a complaint and raise a concern that I am being treated unfairly. For example, I'll give an example. Few years ago, there was a doctor from African black heritage who was not being paid how much he should have been paid. And the poor guy, he didn't take much notice in the start. But then when he took all his pay slips and made a calculation that why am I being paid so less, it turned out that he was not being paid properly. Then he raised the concern, and then the hospital had to apologize to him and give him all the money that he didn't get. And this problem didn't happen with Indian or Pakistani people, didn't happen with the white British people. It only happened with that particular doctor of a certain skin color. Yeah. So why with this one person? Why so randomly? So and similarly, I have personally faced a lot of incidents of racism as well. But each and every time I raised a complaint, and 90% of the time my complaint was answered. Okay,
Mhm.
so the message I'm trying to give to the medical students is that if you are leaving your home and coming overseas, don't expect that everybody will welcome you with open arms. No. There will be people who will not like your skin color. There will be people who will not like your accent. There will be people who will not like maybe your religion. There are all kinds of haters. What matters is that if you are facing problems, are you a man or woman strong enough to raise complaints against it? Because unfortunately, I don't know about the country where you're from, but from Pakistan, India side, many doctors who come to the UK, when they face these kind of problems, they choose to remain quiet. They choose not to escalate this. They choose not to make a complaint, and they continue to suffer until it's too late. So don't suffer. If there is a racism problem, raise complaints. And yes, in UK there is racism.
Thank you very much. In Germany, that might be racism. It is in each country, as you said, Hussam. That was a very great sentence. But you can file a complaint, ask for a financial
Absolutely. Compensation.
so
Yeah.
compensation. Thank you very much. And there is a law, and you can complain at any time. How much time do you still have?
I think I have 10 more minutes here.
Great. Documentation of work. In Germany, we need to write a lot on the PC to do everything very detailed. How is it in the UK?
Absolutely the same. Lot of documentation. Lot.
Very good. As an internal medicine resident in the emergency department, have you ever worked?
Yeah, yeah.
Internal. How many
Inter-
patients would you see in 8 hours shift?
In junior years, the consultant will make sure that you don't see more than, I mean, there's no fixed number, but usually you would see more, about 7 or 8 in a 1 day shift.
And how much documentation do you need per patient?
At least 2 pages.
Wow, thank you very much. What do you think? Like in a typical UK hospital, what are the nationalities of doctors? How many are the UK? How many are Europeans? How many are not Europeans?
So I don't have exact percentages, but you will find a lot of Arab doctors, lot of Indian Pakistani doctors, and the white British doctors are there as well. From Europe, the maximum number of doctors I have seen are actually from the Eastern Europe,
Romania.
Bulgaria and Romania, those kind of places. I have met very good and very competent doctors from the Middle East, from Jordan, Egypt, from Iraq. They're very close friends of mine, very respectable people. It's a pleasure to work with them. You will find a lot of them. And if you are from the Muslim religion, then on every Friday, we make sure that there's a room booked for us where we can do Friday
Great.
prayers. And sometimes there are so many Muslim doctors that we have to, and the room space is small, we have to do 2 Friday prayers. So
And what is with the
the
working time in this prayer? Is it counted as working time or as a break?
as a break.
Okay, great. So how much of the resident doctors are UK? Like from 100, how many are UK doctors?
I can tell you in percentage, they are around
Feeling.
40 to 50%. Yeah,
Okay, in
40
Germany,
to
I think
50.
it's a similar number. Thank you very much. How many years do you need to get the German, to the UK passport?
6 years. So after 5 years, you get something called indefinite leave to remain (ILR). It is similar to the green card of US. You get that after 5 years, and 1 year after ILR, you get the UK passport. So total 6 years.
Okay, thank you very much. Salaries in the residency period.
In the residency period, the salary in the early residency period is about £60,000. In the
Per
senior
month, per
residency,
month.
no, per year, sorry. £60,000 per year, which after taxes and pension turns out to be roughly £3,500 per month. £3,000 to £3,500 per month. And for senior residents, it is around £4,500 per month. And at consultant, it is around £5,500 per month.
And working hours, this is work for working 40 hours.
It's 40 hours, yeah.
And the consultant, five and a half.
£5,500. But the consultant also has the option to work in private.
Okay.
Because NHS, the UK hospitals are all government. Unlike Germany, they are not private. They are government.
Okay, and if you five and okay, and is there NHS? There is no negotiation, so no one will be getting like
Fixed pay.
okay. And to work in a clinic, your own clinic, or
You have to be a consultant. No level junior than a consultant can work in his own clinic. No.
okay, if you are a consultant and you have your own clinic, how much money would you earn? Of course, depending on
Depends on
specialty.
your specialty and your expertise. I think a surgeon, an orthopedic surgeon, if he replaces a hip or a knee, will earn much more than a simple internal medicine specialist or a
Approximately.
neurologist. Yeah, man, you can go up to two and a half to £5,000 a month extra. But the more you earn, the tax bracket goes up to 45%. You need to
Wow,
keep that in
it's a
mind.
lot. In Germany, there's an article about that income of doctors in hospital. You can see that it depends on the specialty. It could be 400,000 before taxes for such specialties as radiology. Great, Hussam, thank you very much. And how much, if you are a resident doctor or if you are living there alone, how much money can you save from your salary? Or how much money do you need to spend?
So if you are a bit mental like me, when I came in the UK and when I got the driving license in the UK, my first car was a Mercedes. Okay. So if you are a mental person like me, don't be like me. You are not going to save anything. But if you come here and if you spend less on the car, and if you, in the early years, live in a small flat whose rent is cheap, trust me, you can save a decent amount of money. But if you want to buy a Mercedes or an Audi as your first car in the UK, and if you want to live in a big house of 4 bedrooms, then you're not going to be left with any. So it all depends on you. But if you are spending sensibly and not spending like crazy, you will be able to save at least £1,000 a month.
Thank you very much. This is for a salary of £3,000.
Yeah, yeah.
Thank you very much. Recognition of the specialty worldwide. It is recognized in the Gulf areas. No exams, right?
Absolutely. CCT, like I mentioned, is recognized in the Gulf. CCT of the UK is also recognized in Canada, also recognized in Australia, and like I mentioned recently, in some few states of America where they're dying to get doctors, they have started recognizing CCT as well. Also, it is
Great.
recognized in New Zealand also. Yeah.
Thank you very much. For the recognition of the German board, there is this article on our website. You can read it. It is to save time. Geographical retirement system. How much retirement age in the UK is 67 for men, for 65 for women?
I think it's 65 for both, I think.
Okay, and how is the salary after retirement?
So every year when you are working, you pay a little amount for your pension.
Of course, you work until 65. How much as a retirement salary would you get?
So it depends how many years you have worked in the NHS. Usually people can get up to 100,000 or 150,000 pounds as pension.
Wow, this is a lot. In
It's a lot,
Germany,
yeah.
it's maybe 550 to 60,000. Good.
Really?
Yeah. And there are starting salaries on your rent. Before a few years, they do not pay taxes on that. And unfortunately, in Germany, they are starting doing that. Criminality. Is it safe to live in the UK? You do not need to answer this.
Some cities are not safe. Some cities have a very high crime rate, and everybody's favorite city in England, London. I think that's one of the crime capitals of the world. So
But
if you are in London, my
yeah.
frank advice is don't go out at night alone. Never. There's a knife crime. There's a lot of other crime. Okay. But other smaller cities are actually pretty safe. I sometimes go for shopping and do some stuff, and I don't lock the door of my house. It is so safe.
Great. Thank you
Very
very
safe.
much.
Yeah.
At the end, Hussam, after we heard this small comparison, what do you think? What is better, Germany or the UK?
I would still lean towards UK because compared to Germany, you don't have to learn a different language. We all
Okay,
read
I
about
totally
English
agree.
from our childhood. Then UK welcomes at all levels. Even if you have done a residency in your home country, UK will welcome you. Some cities of the UK are very welcoming towards Muslim people if you are Muslim, and then halal food is not a problem, and so on and so forth. And then the thing about UK is that people in general, I know racism is on the rise everywhere. In general, people in the UK are very polite, kind-hearted people who will always be nice to you. So they will smile at you. They will say sorry, thank you, please. Very polite people. So I would still say it's UK. But having said that, I absolutely love Germany that you can enter into specialties which no one can even think of entering into residency in the UK, like surgical, radiology, etc. And Germany also has a very good system in which the number of training years are far less than the UK. So over there, Germany is much better than UK.
We mentioned cardiology in Germany, it's 6 years and you are finished. Psychiatry, 5 years, neurology, 5 years. What is good about Germany, if you got this position in internal medicine, then you have it, or cardiology, then you have it. It's not the UK. You need to do these postgraduate years and then apply again, and then exams, MRCP. And the exams in Germany are much easier. Of course, you need to learn a new language, but German is easy, similar to English, so it is not that hard. The salary is similar, UK, Germany, but recognition in the Gulf countries, it is better for the UK graduates than the German ones. Of course, wasting time on a new language is not like studying medicine. It is like for and against both countries. I would
But
say,
no place is perfect.
yeah. No one is perfect. No country is perfect. Thank you very much, Hussam. We are very happy for this interview. I thank you a lot, and I wish you a lot of luck. If you ever visited Switzerland, I know where I live in Switzerland. You should visit me. Thanks a lot.
Thank you, mate, and I'll see you again. And I'm happy to do more talks in future. Thank you very much.
Me too. Thank you very much. Thank you very much. Ciao.